And away we go. So let's start with the lecture. Are there any questions before I start? Anything you might have?
No,
I don't think so.
I'm good.
Okay. Okay. So restorative 1. We used to have everything kind of melted together. Now we divided it up into a more simpler general dentistry terms. Restorative 1, we're going to start from the beginning. And of course, you have all this in the lecture. The welcoming, certainly we went through that. I emphasized on a number of things here. Talked about safety, attendance, time, pacing yourself. You know, all these items are going to hit pretty well during the lecture. So let's talk about hand instruments. I'm going to zoom in, and there's one in particular instrument right here. It's called an Explorer, and this one right here. Now, your instrument, obviously, on one end you have the curved end. It's very sharp on the end. And that's for filling line angles and point angles and anything that's rough. So this is a good indicator, a good way to check your smoothness. Just next door over here is the other tip. That's called a periodontal probe. That's on the other end of this instrument that you have. That's your measurement for depth. Okay, so periodontal probes also measure depth of pockets around teeth. They measure the amount of soft tissue that actually supports the teeth. So this instrument is a very valuable instrument. That's why I put that in the kit, because you're going to be using that quite often. All right. The other one that you'll look at is over here. It's a plugger. Now in your kit, you'll see you'll have a blunt end plugger, a kit called the P.K. Thomas set. And that's your waxing set. One of the instruments out of that actually has the small enough diameter, the width of this diameter, to fit into areas of the preparation, certain zones that are called dovetails and isthmuses, things that you're going to measure in between, so that when you go to place a filling, you'll have the right diameter of the instrument that can push the filling into place. You can't fit a large instrument into a small area because it'll be obstructed by tooth structure. So you want something that's conservative, yet not too small, yet not too large. So we selected one that fits nicely, and you'll see how we do that in the lecture. So those two instruments, really no concern about anything else at this point. Later on in part 2, we have surgical instruments we'll be going through, and also scissors and things like that, and scalpels. How about the dentition? You know, when you're a young person, you have 20 teeth, and some of these teeth also are very similar to that of the permanent dentition. So all of these teeth are going to exfoliate, they're going to come out in what we call your mixed dentition phase. Again, our emphasis here is on the design of these teeth, and we'll talk about that. You'll find in the pediatric lectures with Dr. Talia Pike, she'll go through this in depth about pediatrics and the growth and development of the child, and how important it is to maintain these teeth for space maintained and arch form and development. So again, that's important. They're also in alphabets, okay, so not numerical yet, so still with letters. So A through J and then K through T. I believe you guys will be prepping J for a full crown in part 2. Now, here we are, 32 teeth. We're seeing less of 32 teeth now. We're seeing more in a dentition that, for some reason, the third molars aren't coming in complete as much as we used to see. They're actually embedded and partially impacted, fully impacted. Perhaps it's the diet, perhaps it's the gene selection. We don't know. But I have 32 teeth. Unfortunately, 4 of the teeth, when they erupted with some decay. And we'll talk about the grooves and fissures and pits. Quadrants, usually I think about teeth in quadrants, posterior quadrants, anterior quadrants. Important to know how to group teeth together and how to understand their function as well as aesthetics. We'll move on. So again, starting in the upper right, 1 through 16, lower left, 17 through 32. Let's talk about the anatomy, the cross-section of a premolar. A premolar is a bicuspid. It has two cusps. Is that true? At times we'll see the lower second bicuspid will actually have three cusps to it. So you tell me. I kind of like the word premolar more than I like the word bicuspid. So if you cut it in half, you got layers. The outer layer is inorganic. It's made of a material, hydroxyapatite, and this material has a lot of calcium in it. So it's the hardest part of the body. It also folds on itself and creates something called a pit and a fissure located in this area, right, right in between the two cusps. If you also notice a little bit, we'll come back to this later on in 2 weeks, but you have cusp tips and cusp heights. Sometimes they're not lined up with each other. Sometimes one's a little longer than the other. It's part of the anatomy. It's part of the anatomically correct proportion of the tooth. The next layer is a organic layer. It's called dentin. It is a very sensing layer. It communicates hot and cold and touch from the inner portion, which is the pulp that has the blood vessels, the nerves, the connective tissue of the tooth itself, the vitality of the tooth. So it's going to communicate. Are these repairable? Yes, they are. Enamel and dentin have a certain amount of reparative properties or regenerative properties. Mineralization and demineralization, you'll hear those terms in dental school. And what can create the regeneration of tooth structure? Fluoride helps the tooth to create reparative dentin and its properties. So there's a certain stimulus, and we'll talk about what causes the changes that occur, cellular changes that occur within these two layers. The pulp is the heart, it's the heart of the tooth. How important that is to maintain vitality, color, and just the normal health of the tooth. And endodontics, you'll learn about this pulp chamber. You're going to learn about the association of the anatomy of the tips themselves, the frame, and the constriction of the frame, and how important that is, and what happens when a tooth loses its vitality and the nerve dies and it starts to necrose. This important landmark here is called the cemento-enamel junction. It's because the enamel on the outside ends at a point on a tooth, and then we run into something called cementum, which is an outer layer of the root structure. How important is that cementum? What is its role? And how important it is to communicate cellularly between bone, ligament, and that of the tooth. So it plays an important role, and we have to maintain that as well. Can we see cementum grow back in certain areas where it's been changed or denuded? Yes, absolutely. Surgical techniques will often promote with growth factors the reparative properties of cementum and then also ligament. So you're gonna run into all that in dental school and oral anatomy and then oral histology. We're going to try to keep it more on the side of hands-on, but just to know that those structures exist. This is the guy that we're going to be talking about a lot, is the cemento-enamel junction, because it is kind of like the end zone or the barrier, the part that we don't want to go past that. We want to stay above it in our preps. All right, here's the guy that started it all, right? He's also one of the deans at Northwestern University. His name is Green Verneman Black, Dr. Black, classification of carious lesions. Devoted a lot of his life to teaching. And if you're in the archives, I believe it's in Maryland now. It used to be in Chicago when the school actually was open. You would see all of his teachings, all of his props. He had very large teeth, the size of an end table, or a cart. And those teeth actually had little puzzles of fillings that he would take in and out to show the various types. And each one of these classifications actually has a wall a dimension, a line angle, a point angle. A lot of things happen. So we go from the most simple, which is the occlusal areas of the buccal and lingual pits of teeth, whether it's posterior or anterior. Anteriors will see lingual pits. Posterior, you're going to see buccal pits. And the chewing surface, the occlusal surface of posterior teeth are class 1s. That's what today's all about. Class 2, in 2 weeks, we'll talk about interproximal, which means to proximate between. That area where you floss in between your teeth is the interproximal area, where 2 teeth touch each other in the arch. They make contact within the same arch, I want to say. So class 2s would be posterior interproximal lesions. Class 3 would be anterior interproximal lesions. And then we extend that one more to include another surface or a corner of a tooth, and that's the anterior interproximal, including the incisal corner, for class 4. Class 5, which we'll cover today, is the gingival at buccal, facial, or lingual. So gingival, also we call the cervical region, that area that's very close to the CEJ, a little bit above it. It's in the 1/3 of the tooth that's the closest to the gum line. And then you end up with a class 6. Rarely ever talk about this in dental school. You know, I had to look it up again, be honest with you. It is the cusp tip of posterior teeth. Rarely talk about class 6 as far as our nomenclature is concerned. But he did include that. All right, and so this has been going on for many, many, many years, has not changed, and probably will never change. So, you know, you need to follow guidelines. What about decay? What happens when the door is kicked in on the enamel? What's going to take place? Enamel, I said before, is the hardest structure in the body. So bacteria is going to find a small little opening somewhere. Here, what we call the pit and fissure area of a tooth, this is where the bacteria might stick, and you might see some stained areas in this region. You might see some food getting caught in here. It's very difficult for a brush bristle to fit in this area. So we end up with an impaction of food. Eventually the carbohydrate, along with the acid of the bacteria, form enzymes that actually break the teeth down. And so that's a prone area. Another one is the cervical area, or the gum line area here, gingival area. Remember the CEJ, we're right above it. We'll talk about what causes cervical decay. And then, of course, interproximally, there's a few things that contribute to this area in between teeth that will cause a class 2 lesion. All right, so we'll move on, and here are your tooth preparation designs in this course, except for one, which is this one here, but you can also extend one of your preps. Let's talk about the class 1, the molar. This is tooth number 19. This is the one that I have outlined for you tonight, as well as the class 5, which is depicted here on the premolar, and then the class 2, which would be on the lower premolar, and then, of course, the interproximal area of decay on upper anterior teeth. Here it is on a central incisor. And then finally, the extension of that class 3 to a class 4. Our focus today is here and here. So let's look at these X-rays. Today, we're all digital. If we're not, we're in the Stone Age. So the sensors we have today are quite expensive, but they work. They work for a period of time. I want to say the life expectancy of a sensor could be 5, 6, 7 years before it starts to show degradation. So if I were to zoom in and show you, these of course called bite wing X-rays. Let's zoom in on some bite wings here. So every day I'm looking at X-rays. Every day you'll be searching. Do you find everything on an X-ray? Absolutely not. There's a certain amount of distortion factor in an X-ray. I always say to my patients, 70% is exactly what we can see. The other part of it, we have to look in the mouth, physically look with a bright light, and to be able to try to find out, you know, areas of decay that way. What do you see when you look at this X-ray? Well, you see something super light right here. These are metal fillings. The next level of I want to say opacity, which is a little less than this, These are called composite fillings, okay, or tooth color fillings. We also called it bonded resins. The metal again is amalgam. Amalgam is made up of silver, tin, zinc, copper, and mercury. That's right, mercury. And they're still teaching it in dental school. So we'll talk about the preparation design for the amalgam itself. Interproximally, in between teeth, we find a zone of decay, a little dark area here. And so that is not to be confused with the pulp itself. Here's the pulp. In between the pulp, let's just say in bone, here is this is all dentin, and the enamel certainly is the chewing surface. That's the crown portion of the tooth. So you have this change of color, and you have to, you'll learn this, and as you go through dental school and taking X-rays and taking your first full set of X-rays, you'll observe all these things. You'll observe the crest of the bone and the quality of the bone, and you'll look and try to identify certain things that can be found within the pulp chamber. We're going to keep it a little simple here today. I put arrows in the areas where I thought that there was definitely signs of decay. Here is, maybe this arrow should be a little bit more over here. This is the area of the dentin and the enamel, and we call the dentin enamel junction. You look there to find most of your decay. Here's another area that's spreading, and let's blow that one up a little bit more. See that whole area? Perhaps this could have spread from just a little pit, got through, and then once it hit the dentin, it found freedom. It wanted to go in there and it wanted to remove all of this organic matter and start to hollow it out. So that can happen. I'll show you actually some real teeth, and you'll see exactly what I mean on that. Moving over to the other X-ray again, how do you define this area? Sometimes you get too close, and sometimes you have to back it off to actually see the contrast. Take a look right here. Focus right on that. Let's move in. And if I move it, sometimes you miss it, But there's decay right here. Let me move that one back. Maybe you can see it better from a distance. See it? Actually, it spreads all the way in here. All right, so there's different levels of decay. Today, we're classifying enamel as E1, E2, and dentin would be D1, D2, and D3. Again, you'll learn about those classifications in dental school. Does anybody know what an intraoral camera is?
That's it. Your mouth?
Yeah, it's a camera that you can go in the mouth with. It looks just like a small wand, or maybe smaller than a curling iron, I want to say, perhaps a little bit larger than the end of a toothbrush, So it's about the width of a tooth, has a camera on the end and a light on the end, and it actually will take very nice still shots for you. These are taken with, I believe, a microscope camera, but very similar to an intraoral camera. And if you see all these little lines in here, these are the grooves. And I made this in black and white so that you can actually see the contrast better. So some of us will say, well, what are those? Are those stained areas, or is it true decay? We have to decide that. We have to make the diagnosis as clinicians, and we have to rate it. You might decide, well, I'm going to watch that over time. Maybe I don't need to go and be hurried up in there and clean that all out in place of filling. Look at the other amount of evidence in here. Look at this right in here. This is called a dental sealant. So this patient at one time, maybe in their teens, maybe even earlier than that, they had a little flowable resin called a sealant placed, whether it was by the hygienist. You might even have one in your own mouth. It's there for prevention, prevent the tooth from decaying. It actually fills up the groove. I think there were a little bit too much in here with this one, and as well as in here. But then you got to observe these areas, and you got to make decisions on whether to treat or not. At least show the patient, talk about it together, and make a determination. First thing they're going to say is, that doesn't bother me. I have no symptoms. Why should I be that much concerned? But if you at least raise their level of IQ and a level of awareness, perhaps someday it might be sensitive, and then you can go in and take care of it. I'm more on the side of early intervention. I'd rather go in and clean it out with the scope and go ahead and place a conservative filling. So that's my opinion. How about the gum line? Remember I showed you the cervical area. What causes these lesions? Some of them may be non-carious. Some of them may be decay. So caries and decay. It's a word that means the same thing. It's I like to use caries, but I might at times use decay as well. It means the same thing. If you focus on these areas, you'll see at the gum line. How can that happen? You know, anybody? Anybody know the? What if you load up a toothbrush with a lot of toothpaste and you got a habit? You like to go to one side more often than the other. That can wear down the enamel, especially at the neck of the tooth. Your anatomy and your biotype is very thin in this area. The enamel is thinnest at the neck of the tooth, so it's prone. We now have studies that show us that it is not so much the brush anymore, it's the paste. Various pastes have different size particles, and the particles actually are made of hydrolyzed silica. So silica is found in pumice, it's found in sand, and it's the gritty part of the toothpaste. That's what takes off the biofilms. That's what takes off the bacteria that accumulate the plaque. But we have to be very careful with the amount. I always tell my patients, spread it all over the mouth first, and then get into your routine. This way you don't have one area that's more concentrated than another. All right? How about other things? What else might cause a problem? There are probably two other reasons. One could be acid erosion, which either can come from the stomach, which is hydrochloric acid, or there might be a particular fruit that this patient likes, like grapefruit or lemons, or even soda. You know, it doesn't have to be sugar so much as is the carbonation. Carbonation has a very low pH. Carbonic acid is CO2 blown off, and so it's very acidic. So if you're swishing a soda, you'll find eroded areas around the gum line. It's a very prone area. You have braces, you know, and your braces were on for a long time and you drank a lot of sodas. Well, you're going to get scarring in these zones and eventually decay. There's one more reason. Look at this tooth, the edge of this tooth, and look at the edge of this tooth. You're going to find, wow, this one's nice and pointed and this one's worn flat. You think maybe the torquing of this tooth or the bite might be causing a change in the neck of the tooth. We call that an abfraction in dentistry, but it's still an open jury. We still don't know for sure. We see an association between worn dentition and abfraction lesions at the neck, but again, we can't simulate that in a lab. So in vitro versus in vivo, you know, it's very difficult to simulate that. So we have to look for it. We look at our cases. We try to make a determination on proof. You know, at times we are, engineers of just finding out problems and making our own judgments. You know, so again, you'll learn about these in dental school. Now, this is a cookbook to follow, but what I would like to do is leave this to you guys to read through this. Certainly, if there's anything in here that needs attention, you'll find it and maybe bring it to my attention. But it's a representation of the Class 1 and Class 5 teeth preparations. Occlusal surface on number 19 will be covered, as well as the buccal pit. And then, of course, the Class 5 of number 19, which will be on the lingual buccal, and then also, on the lingual gingival or lingual cervical side, and then the buccal gingival side of the same, at tooth number 12. All right, so let's show you what that all looks like. Terms, of course, are listed here. Your photo presentation and quiz, we'll talk about that, how to set that all up later on this evening. So here's our tooth. I'll run through the design. Looks like a horse, doesn't it? Or maybe an M. It goes up, down, it's like play psychology, you know, it's there, you're going to follow us, but there are specific landmarks and in that you must learn, you know, the specific cusp tips, the grooves, the pits. Those are the three things that, you know, make up the landmarks, the true landmarks of the lower first molar. Try to keep that in your mind as you're prepping a tooth, that, you know what, I can only go so far. I can't go too far up the tooth, then it's too long. Not enough, no good. We have to go a certain distance. And how do you measure that distance? How do you get a feel for that? Well, you have the demos to follow, but eventually you won't have a demo in front of you. You'll have to do it, you know, from memory. And not in my school, but in dental school. All right. Depth cuts. How often we talk about depth cuts? I still do depth cuts today, especially in crown preparations. And we'll cover that in Restorative 3. But here we have 4 depth cuts. They're all in the pits. Some of them are going to be deeper than others. The main goal is when you finally connect all 4 in a linear fashion, that the floor that you create will be straight and will be level. So you have to think, wow, this is kind of like a little, you know, it's a 2-dimensional roller coaster here, but when we look at the tooth, you'll see what I mean. And this dimension in here, this is called an isthmus between one wall of one side of a tooth on the lingual side and the wall on the buccal side. Also, we'll be talking about the dovetails. This one is has an angle that's a little more, I want to use the word obtuse, and this is more acute, has more of an angle to this dovetail. So we'll talk about those regions as well, along with the grooves. And then again, final depiction of the preparation design. You know, it's not, here's the buccal, the mesiobuccal groove area, and you'll be in here. And if you go a little further distal, you'll drop into the lingual groove. It's not completely 90 degrees from this tooth. It's off a little bit. Okay, so if you deviate a little bit to the right, you didn't really pay attention, you know, to the actual groove itself. So that's why we've given you 2 molars to work on. You know, we want you to make mistakes. We want you to learn from the mistakes, and you know, we want you to feel confidence, you know, going in on the prep. Here's the buccal pit. Notice this depiction doesn't include the distal pit, which is over here. So this is the mesial aspect. This is the distal aspect. So you're looking at a very large depiction of the buccal pit depth cuts here. There are 3 of them. Actually, these are a little more closer together on the typodont tooth. So here I'm blowing it up for you. We're going to make an equilateral, somewhat of an equilateral triangle, okay? And with the same depth and a very nice floor to this preparation and nice walls. When you look at a prep and you close one eye, you shouldn't be able to see the internal line angles. You should be able to see the external margin. And then if you tilted the tooth on its side, that's only when you'll be able to see it. Otherwise, you're getting something called funneling. That means that the outer portion of the prep is larger than the inner portion of the prep. We want to try to keep it parallel as much as you can with an amalgam prep. It teaches a lot of disciplines and your recognition of a part of a tooth beyond the outer surface, a good 1.5 millimeters inside the tooth. All right, and here is the flip side of the tooth, and that would be the lingual. Now you'll extend your depth cuts again close together, but we have now a trapezoid to make, okay? So let me skip here to the next view, and I'm going to say that this portion of the prep and this portion of prep are there for a reason. Why do we do this trapezoid? Why are we teaching that? And part of the reason is we want to teach you walls of tooth preparation are also parallel, consistently parallel with the outer contour of the tooth. So in this area is the gingival third. This trapezoid many times is what you'll see in the mouth, just because of the way the decay continues to develop. And so we want to be able to simulate a more ideal preparation. The occlusal and the gingival walls are parallel with each other and level. So your tooth should be standing up straight, and you should see these two areas parallel with each other. These diverge in, converge out. These two are parallel. Again, if you estimate, maybe you got 1.5 more depth cut here, and it looks like you got only 1 more to go here. And I'll show you some samples of that. Again, the final outcome, close one eye. You should be able to see right in there without seeing the base of your prep. Everything should be nice and smooth. Again, on the premolar, this is the occlusal portion. This is the gingival portion. Same type of design. A little tighter in here because it's a smaller tooth, smaller surface area. Again, keeping the walls, the mesial and distal walls, parallel with the actual contours of the tooth itself. How important that is. You'll hear that over and over again on D2 as you design your preps. You'll have many teeth to prep in D2. Questions so far? Haven't talked about burrs yet. Haven't talked about instruments yet as far as looking at them. So let's go right to it, shall we?
Sounds good.
Let's get to it. All right. And forgive me on any. There we go. And we'll hit the focus button. Terrific. All right. So in your kits, you have the quad articulator, which is nice. I'll get this cursor out of the way. Too far. Let's see. We're going to go view, full screen. Hello. Oh, maybe I read that wrong. Okay. Oh, okay. I did. Sorry. Okay. Keep him out of the way. Very nice. I like you to use this as a reference. I don't really want you to, if you can avoid holding on to it and prepping, because if you do deviate, you might nick some of your other teeth. Try to keep your articulator very clean and healthy looking, because when you go to present this at your interviews, you really want to have something that looks presentable. Although we're going to be working with it, but if you're going to prep a tooth, try to use your tooth clamp, which makes it very comfortable in your hand. You can see all different angles to it. This is a little too bulky, but you'll need to present your photographs, hopefully on your typodont, your quad articulator. All right. So here's an example of one tooth getting ready to be presented, and most of your photographs that you'll take, you want to use a strong light. I'm using a fluorescent light right now. You can use an LED light, or try not to take photographs with your phone with their flash on. You take them with your phone, but no flash. So get a strong light. I wouldn't recommend maybe just get your desk lamp and bring it in close, and that should be all you really need. Try to minimize things. So when you're taking your picture with your iPhone, get your iPhone turned on, go to photograph, and now you got your phone set. Now you want to take that, and you, instead of getting real close because you're going to be blocking the light, step back a little bit and then use your zoom and just zoom in on it, and then hit focus and go ahead and take the shot. All right, so I'm just doing this, but trying to get it so you can see. Yeah, this is better. Anyway, it's like looking through a mirror. Okay, so you get the idea. You take a picture, etc. All right. If you wanted to send a photo in to me early for me to just kind of check your progress, I'd be happy to look at it. That's no problem. Just send me a note. The photos you could upload, I'll take a look at it. But when you come time to do your final upload, that's when we want to see, exactly what you know. All right. So let's look at some examples. If I want to pop this out, I'll take my penny nail that comes with the kit, just stick it all the way underneath and pop it up. And then it's in your hand. Now you can compare. We've given you some demos to compare with. Let's look at some other students' work. Here's one that's prepped a little bit too much. And let me zoom in on that. So let's compare these two. All right. This is your PK Thomas. And comes in a kit. This is your kit. It's all the way on the left, and it's the smallest end. So that'll be simulating your condenser for a filling. Why not use that? It has perfect diameter. So when you're placing it in there, let's make sure we have the right size. Yes, this is it. You can drag it through the prep itself. Let me focus a bit more with zoom. And you can drag it into areas, especially in the dovetail area, and also into the lingual groove. Here I'm a little tight, I can't get through, so I want to open that up just a little bit more. I may want to touch it up a little bit in there, or just polish just a small amount, and then drag it through here. This is ideal. All right, and again, that's a proper way of finding out. This one, hey, we got a little out of hand here. Way too much room in the isthmus areas. There's not enough dragging it into the groove here. This one it's lacking a lot. You know, it is what it is. You'll get graded down for this. You'll pass, but it's not going to be a big pass. You might be a CC minus here. All right, so be careful on staying conservative, and we'll talk about how to do that. Here, these pits are underdeveloped. The preparation design, not quite right. Here, it's well developed. Equilateral triangle. Close one eye. Hopefully, you just see the outer portion of the prep. Careful not to let this one get out of hand. It can get very large in a hurry. So be careful. There's some more conservative preps. Here's more conservative than that one, slightly. The prep design's a little more different here. If you look at the lingual one, this one's way too big on the left, and this one's better, but got a little too much going on there on the pulpal floor, and actually dropped a depth cut too far in. So if you happen to drop a depth cut too far in, leave it. Don't follow it. Don't don't thread it. It's just going to happen, and just say, you know what, it's part of tooth preparation, learning how to use the instrument. So I've shown you the after, but let me show you the before. Let's see some natural teeth. This is a molar. This is the instrument that you're going to be using to check your line angles. It's the Explorer portion, the double-ended instrument. This is the one for measuring. So if you explore decay in the mouth, you're going to drop into certain areas that will allow you to go in, and you can actually move the Explorer laterally, and the whole patient's mouth will start to move. Other areas, you'll start to do that, and it's a little more resistant. It's, you see it, and it's not as deep. Should this be restored? Should that be restored? Should I do the whole thing? Go in and clean all the grooves out. In my book, if I see decay like this, and let me show you that area again. Let's see if I can go a little closer. See how black it is in the middle and how brown all this is? I call this bioburden. That's mixed with food, dried plaque, etc. It may not be true deep decay, but if I'm going in to get this, for sure I'm going to clean that all out. And what dictates tooth preparation design in the mouth is the amount of decay. So all the stuff you learn in technique, somewhat throw it out the window. I'm not going to say that learning those techniques are important, because you'll understand proper depth. You'll be a little more cautious when you're starting out of going how deep you need to go right away with a high-speed handpiece, because on a high speed versus the low speed that you're using in D2, there's a big difference between the two. You can easily prep in here and maybe go too far when you're first learning. This is all just stain on the side of a tooth. And of course, this is actually an area of decay, and I believe somebody filled this. So let's look at another tooth. I got a whole bunch. And it's good to learn this. It's really good to see it firsthand. You'll be responsible in dental school to actually accumulate a certain number of extracted teeth, and you'll be doing that before you enter your first year. So you'll be good friends with your oral surgeon. He'll get you all the nice teeth. These are incipient areas, so they might be classified as an E1, or maybe getting closer to an E2. So you can explain to your patient, we could clean these out and put sealant in there, or a very liquidy, flowable composite, and then prevent it from getting any worse. So you work that out with your patient. Or if you want to watch it over time, that's your call. But what are we watching? You know, is it going to get worse? Is it going to be better? Is that going to remineralize? Is it going to change? Is it going to stay dormant? You know, there's a lot of talk about that in the industry. This is what happens, you know, when you take an X-ray. Obviously, you can't see this from above in the mouth. But you take an X-ray, and I'm sure this is going to show up. But this is the lesion that occurred. Why did that occur there? It could have been food, got caught beneath the contact area. This is the mesial aspect, so there's another tooth in front of this. Once decay gets in, it starts to undermine the enamel. So look at how far in I can take this instrument. It goes up all the way up underneath the enamel. I'm way up in here. So it kicks the door in, but it doesn't do anything else to the enamel. It wants to go after dentin, the soft organic part. It needs the food in here to survive. Bacteria needs it. So it's looking for carbohydrates, it's looking for tooth, and once the acids are going to be produced, and it's going to break it down. Here's a class 5 lesion below the CEJ, all right? Non-carious, erosion from toothpaste, perhaps. So that's kind of neat to see that. CEJ, the cemento enamel junction. So here's enamel, very hard, very dense, has a surface texture to it that's somewhat smooth, but you can also see the light reflecting in different paths. When we make teeth out of ceramic, we want to make sure that we end up with the same surface texture, and we'll learn about that with Toby. We'll talk to you during the lab skills 1 module. We'll talk about how important that surface texture is. All right, so too smooth, no good. The teeth look fake. And then again, they also collect bacteria. One more, and then we'll get started on looking at some other things. Oh my gosh, look at the erosion here that occurred on the root surface. So decay can not only start on the occlusal portion, but you can also get root decay in both of these areas. And I see that quite often. It happens when you're probing, when you're finding out, you're feeling under the gum tissue with your periodontal probe. You might feel into this area called the furcation, or you may drop in to this area. And I've seen that happen, and I had to actually numb the patient, move the gum tissue down, place the filling, pull the gum tissue back up, that type of thing. So again, you use these instruments as feeling instruments. Very easy to see some of these areas. And you know what? You get all excited on your first filling. You say, wow, I know I got an easy prep here. I dropped in. But by the time you clean all that decay out, you have something that doesn't look too ideal. and you'll be all caught up into it. But then you'll ask your preceptor, you know, what do I have to do next? Do I have to put a base, a liner in there? Do I protect the pulpal wall to make sure that this patient doesn't experience cold too much when they're having, you know, ice cream or soda? Let's talk about the tooth itself without any preparation. I'll just take a virgin tooth and we'll look at that. So here's number 19. And it has anatomy to it. And I always say, you know what, the best thing you can do is take your pencil and use your pencil. I like mechanical pencils. I had a student that talked to me. He said, you know what, I like this because you can measure with this pencil. It has a certain length to it. And I say the same thing with your burrs. Your burrs also have a certain length. We'll talk about the burrs in a minute. This is almost 2 millimeters. So let me kick that back a little bit and click it out once. And about the same, right? So maybe I can use this tip to measure, and maybe measure my depth cuts. So if I put my 4 depth cuts in there, and then I connect them with each other, right? So you have this line that is like a Z. Okay, so that's your first connecting line, and these are your pits. There's 4 of them. Now you're going to extend it into the developmental grooves. This is your distal groove, and here this is your distal buccal groove. This is your mesial buccal groove. This is your lingual groove. This is, now we're going up past this area. Now we're going into the This is the mesial portion, or what we call the fossa area. So it slightly goes up in there and forming this obtuse angled dovetail. Here's the more acute one. Too far, no good. Stay away from the marginal ridges. We don't want to go too far and then thin them down. We want to stay conservative within the tooth. If you turn the tooth on its interproximal side, you're going to notice that this central pit actually drops down further than this pit, than the distal buccal pit, and then the mesial buccal pit actually goes up higher. So the road goes up higher, then comes down. So there's an alarm that goes off in your head, and it should say, okay, well, I know what he was talking about. This one's deeper. So do I prep it as deep as these others? Absolutely not. You want to go a little bit in on these. I would say just go conservatively first. These are going to be deeper. This one's going to be less deeper, and this one's going to be probably matched up with this one. So it's kind of like a roller coaster here. But you want your prep design so that it can be flat on the pulpal floor. So a floor should be flat. I'm going to look straight at this now instead of looking at the television or the laptop. Straight across. So this wall is a vertical wall. This is the pulpal wall or the floor. Where they meet together is called a line angle in here, and where three walls meet is called a point angle. So you have line angle and then a point angle. All right? Try to remember those, keep them in your mind, back of your head. Also, we talk about the long axis of this tooth, which what I mean by that, this is the long axis from the occlusal to the apical portion. So if you're prepping a tooth, let me draw the tooth here. I'll back this up a little bit so you can see this. Here's your molar, all right, long axis, obviously. So your burr needs to stay in this direction, in this position, so that it stays parallel with the long axis. If you start to deviate and go off a little bit to your right or to your left, the top portion of your prep is going to be much larger than the bottom portion. So when you're closing one eye, you're going to see immediately what I mean. And you're going to end up with a very wide preparation design like that in a hurry. So how do we battle that? Before I give you that information, I'm going to talk about these burrs, because there's two sides, two sizes. And the one on the left, my left, is the 699. It has a certain taperness to it, but it's only used to do the first portion of your prep. So we're interested in the diameter of the tip. It's almost half the diameter of the 556. 556 is what you'll use to finish things. It's very parallel and it's very squared off. It's cross-cut, so it's going to cut and it's going to filter the filings. There's non-cross cut that you'll have in dental school, and you can use those to actually polish preparation, but they're less aggressive. Let's see if I can give you even a closer look at this before we start to show you prep. You see the cross cuts in it? Very sharp. You know, as you run off the road once and you poke yourself in the finger, you'll remember to get your finger out of the way. Don't forget peroxide, Neosporin, and a Band-Aid. Those are the three things I always remind myself as I got nicked today on this finger again. That's just doing lab work. I have a big case I got to do tonight. That's due tomorrow morning. I'll be waxing that up. Whether you decide to continue to wax throughout your career, that's your choice. I did because I just felt that it kept my game always refined and it kept me at my best. So let's talk about hand positioning and burr positioning. Here's the hand piece. I'm going to back this hover cam up. Let's go up with it and maybe hit another autofocus, right? Okay, so I like the modified pen grasp. If I'm going to hold a pen to write my name, I'm going to hold it like this. So the same thing in the mouth, you're painting, literally painting with the burr. Here it's a straight handpiece, so it's easy to want to be able to go right behind it and say, okay, I know what he's talking about, but I can't see what he's talking about. I can't see the prep from here. Although I'm staying, parallel with the long axis of the tooth, I can't really see that. So we really want you to turn it a little bit, check the sides, make sure you're aligned properly, and then go in and do your depth cuts that way. Do one, back off, take a look at it, blow some air, do another one. I'll give a quick demo. I'll show you how to do it, and then it's your turn. So I do have a 556. I'm going to take the 556 off. Don't forget, when you're taking your collets, relieving your collets and getting the burrs out, don't forget the anatomy of the collet itself. It has leaves, 3 leaves to it. They're made of aluminum. And these leaves, 4 leaves to it. They're made of aluminum. Let's see if I can focus that. Okay, good enough. Anyway, they're made of aluminum. So if you're over tightening, you're going to actually stretch these leaves, and then they'll lose their vitality, and you'll be calling me up saying, hey, what's going on? So when you're loading, always put the cap on first, as I said in the video. Now I'm going to look for a 699, and I'm going to load that. And I like to go just a little bit off the bevel, and I'm holding this button until it clicks. The shaft on this burr inside is a square, and it spins around, and it's a definite square. It's a very durable cable that's in there. That's why it's flexible, and it stays in a rubber sheath. I like to tighten it and just snug it a little bit. I'm not overly ratcheting it down. I'm just snugging it up a little bit, holding here. All right? Now, speed is of the essence. You don't want to go too fast. I know you're in a hurry to learn, but too fast is no good. So slow it down. Let me show you the motor. I go between 2 and 4. I kind of oscillate between 2 and 4. Let's do a little bit with just 2, and then I'll go to 4. Okay? The pedal is more of an on and off pedal. It's a foot pedal, but you have some control. You can tap your foot a little bit to control speed if you wanted to. I'm going to put some loops on because I need to. I'm used to a microscope every day. So here we go. We're going to zoom in, and we're going to go over technique. Any questions so far?
No, going good.
Okay. Yeah, this is all going to be recorded and put up in the Canvas, so you'll always have it as a reference, as well as other videos that we have. Okay, so I'm going to start, and notice I'm turned angled already. Look at my fingers. They're close to each other, or they may be resting on the tabletop here. Depends on your style. And you'll always rest your forearms. I mean, your forearms should always be on something, whether it's the end of a table, or you might have a tablecloth on there or a towel underneath you, so it's softer. I've seen somebody put rubber, I don't know, something from air conditioning insulation. They actually put it on the end, so it's super soft to their hands because they want to brace themselves. You want to cut down on the hysteresis or the vibration. And so the burr itself should be spinning without any vibration whatsoever. All right, so that's spinning. We're going about a clip of 4. I'm going to zoom in. And now you've got 2 methods, right? You got your canned air that you're going to get from Office Depot, and you got your toothbrush. And of course, you got your mask on, you got your goggles on. Trust me, if you're breathing any of this, you'll wake up the next morning and you will be coughing. So always put a mask on. Now I'm going to do this demo. So here we go. I'm going to not start in the middle one. I want to start over here. And I'll start with the first one. Now take a look at the burr. Look what happens. Immediately you see a white layering on that burr. You know, so think about it. This burr has a dimension to it. If you were to measure it, it's going to be about a little bit more than 3 millimeters in length, right? So think about the depth already. I'm almost at 1.5 millimeters, maybe 1.25. So take your air gun. If you're a little shy and you want to start out super slow, go ahead and measure it. You know, it's always good to measure things. And I dropped in, I want to say almost a millimeter. Okay, so I don't have too far to go on that first one. All right, go a little bit more, and then I'll stop there. Now you can always go deeper later if you want, especially as you're polishing. Sometimes you'll be putting a little too much force downward. So once you're done with your depths, we're going to go laterally. So let's finish the depths. Okay, so I'm getting a feel for the depth. All right, brush that off. Or whatever. You can take your air gun and dry it. Now you've got your second one. Boom, you're done. This is the distal buccal pit. We'll drop it in there. So I'm getting a feel. I don't even need to turn on the motor. I can get a feel for each one of these. Using this, I'll do this quite often in the mouth when I want to feel a margin too. I'll just turn it off. And again, when I teach in class, I have an assistant, and that person always just dries it off for me. So if you're doing this with a buddy of yours, you know, and they want to do it together, if they want to take the course together, then they can work together on this. All right, and here we go. This one I'm going to leave a little shallow. All right, so there's the last one. Now I got all 4 done. I want to connect the dots. So you do it laterally. Now, I'm going to slow the speed up to 2, and you'll see a difference. Look at that, nice and easy. I'm just going to pull it in one direction, and as I'm doing it, I'm following the groove. So I'm just going to follow the groove. The pencil mark is the key, and like I said before, if you want to remark it, go ahead and do that. Now, I can't really quite fit it all the way in there yet, okay? So the diameter of that 699 really did help. You know, it kept me conservative. So again, I'm going to just slowly. Now, one of the things that's going to happen is this wants to jump out on you. So keep it there. Don't dig any deeper, but pull laterally. Follow the groove. Once you do that, you'll drop into the next depth cut. Once you do that, you're done with that portion. Now we're going to go up. See how I just connected those 2 dots? Now I'm going to go up to this one. So just slowly go on up. All right. I feel a certain amount of roughness on the floor because I'm going from one well to the next, but I'm just tracing out a line. Then do the 3rd one. And you'll feel it drop in. I just felt it drop in to, we use that phrase, dropping in, a lot, especially in endodontics, when you drop into a canal, when you're doing a root canal. You'll learn about that in part 2. Okay, so actually it's right there, so I want to go in it. There, now I dropped in. Very good. See, I was a little bit shy of that, and that's where I had to go. So you see, by using the 699, you're staying very conservative. You're not ready to take this instrument yet. But you can take your periodontal probe. This is way too narrow. Take out your perio probe, and now you can start measuring depths, okay? So I want to stay at 1.5. So it's the first mark and a little bit past that. That's 1.25. And then you can take your Explorer and get a feel for the depth. See, it's feeling rough, but it's not too rough for me. You know, I'm getting the hang of it now. I can start to feel it, but I didn't really make a very deep well, and they're a very deep depth cut. I kept it conservative. Now, I can also go into my other grooves. I want to develop this dovetail, and then I want to develop this one. Okay, so this one, this is the distal dovetail. It goes a little bit toward the lingual here, and it stops right here. Don't go any further. Don't go down in here. This is the dovetail. So here we go. We'll go in, and I'm at 2. I can almost make the motor stop, but maybe that's a good thing, because I don't really want to push it and go too fast and end up with misleading outline. Okay, so it's kind of like that M. Now I want to trace out perhaps my lingual groove, stay on the lingual side with everything. I'll go in here, find the depth, don't push down. You're going to pull it laterally toward the lingual. Stay in the groove. Check your hand position and notice my fulcruming. I got my ring finger and my thumb married together here. See that? And I'm resting on the countertop. I'm laying it down. So let me show you this from above. The opposite of this is what we call that's what I need to do. The opposite of this is called the palm thumb. And this is okay if you're peeling a potato, if you're doing like carving of something where you have this in the finger pad, and you're maybe carving a model or you're polishing something. You'll do this more on the laboratory side, but the modified pen grafts is really what you need to do, whether your fingers are like this or like this. I like to put my ring finger sometimes resting with my thumb, or I may have it rested here. You may adapt to placing it on a countertop on an angle. Now it's against something solid, and then you're prepping this way. I just like, it's kind of like you're playing an instrument, a piano or a guitar. Both hands are occupied doing almost the same thing. So here you're giving some resistance. Here you're penetrating, you're finding, and you're smoothing, and you're directing, the cut of the burr itself. So I just wanted to kind of go over that with you. Definitely use your tooth clamp. If I didn't, this is awkward. You don't really get stability in it. Obviously in the mouth, this will be in the socket, and then you'll be, using your mirror, et cetera, and other things later on. All right, so I just want to show you that real quick. I know we're kind of getting past the hour now, but if anybody's in a hurry and they have to leave, that's okay. No big deal. I'm going to continue to prep, and once you get this part down, class 2 is going to be it's going to come to you naturally. You'll be able to do that in a more natural sense. So I'm going to continue. I'm hoping to get this as close as I can. There we go. Okay, so go down the line angles, or excuse me, go down the grooves, and I would go about halfway. Don't go any further than that. Go about halfway up the ridge and then stop. All right. Same thing here, and I'll blow air in a second, so you'll see what this looks like. All right. So now we're getting pretty close, and then again, use your obviously you can use your model. I think this one I was working on earlier. Let's see. Here's one with a 556, not finished yet, but opened up. So again, quickly go in and just move the burr into the grooves now. I'm just going to speed this up a little bit. And you have 5 burrs, so you got to figure one molar like this and all the preps on it might take 1 carbide, but you'll get a feel how it cuts. A new burr that cuts so much better and faster than one that's dull. And if you do happen to drop this, they break off, you have extra. All right. So again, there's the outline. Now I can switch to a 556. Again, you can measure that. Let's go to a 556, shall we? And we'll finish this up. Oh, it's nothing better than prepping teeth. I tell you, I can't wait, as a restorative dentist to get in to the office, and I know it's a good day for the restorative dentist when you got confidence going in. and you know you're going to do a really great job for the patient, and your work is it's a reflection of your commitment. I always say I'm only as good as my impressions that I take, and it really is true. The more you focus on attention to detail, the better your quality is going to get, and patients are going to realize it because they're not going to have sensitive teeth. They know it because of your comments that you're going to make, your dental assistant's going to make, and your hygienist is going to make. They're all going to be in it together with you. So, step-by-step process now. We'll go in. Look at now, I've got the diameter starting already. So here we go. Again, I'm going to fulcrum a little bit. I want to have a steady hand. I'm going to go and just gently drag it through. You can hear it cutting. That's a sound of a dull burr. You can tell I've been prepping a little bit in here. Okay. All right. Tell your neighbor that you're prepping teeth tonight, and might be some noises transferring down through the flooring. All right. Now, let's go through. If I didn't fulcrum, this is what's going to happen. I'm going to just try to, see, I'm kind of backing up a little bit. I'm not getting the feel of the plane of prepping, or I want to say, you're climb cutting what you're doing. You're climb cutting because climb cutting is you're using the resistance. This is turning in a rotational position. The burr is cutting in a direction, and you want to move your hands against, or your instrument against that resistance, and feel the resistance, so it cuts instead of going toward it. So you're going to be a better prepper if you can find a fulcrum. So keep your fingers or hands together, and then now, as you're doing it, you're starting to smooth, and then find out what does need smoothing. Is it the dovetails? Is it So it's nice. I'm closing one eye now. I don't really see the base as much, but maybe right here I see I have a little bit of a defect right there. I have to smooth that. And you'll notice these things. You'll see it. Shine your light in different directions. You'll get shadowing. You can see detail. Now, remember I talked about this point angle. That means I'm going to go in here and feel this wall as it's vertically, but I'm in the portion where it's folded now into this pulpal floor. So get this in the groove, and you can actually score or scribe that line to really accentuate it. That's a tip. It's a great tip for, I don't mean to scratch the floor. I'm talking about the line angle itself to accentuate it when you're finished. And that just brings out a nice quality to your prep. Again, I can sit here and now all I want to do is just polish these walls and round them. Like, see that little defect right there? And that one right in there. I can just start taking it now. I'll cut my speed down even more, so maybe bring it down a little slower if it'll take it, Let's see if it spins. No, I got to turn the machine on. That would help. There we go. Now it's super slow, and I just want to polish certain areas, get a feel for them. There. That's what I wanted to do. All right. Now, let's just say we do the opposite. Let me kick it up. Let me go real fast. I'll just give you that. Okay, now I'm speedy here. Now I got to have a feather touch. And if I go off the road, it's curtains. But I'm just lightly touching now. I mean, I'm painting, but I'm polishing. And I know there's a consequence if I deviate too far, so I've got to be very gentle in here. And you can see how much is accumulating. It's so fast. Yeah. So that's it. I mean, you go a little bit more to polish. Maybe this could be rounded a little bit, like in here, this is nice and round. Maybe I could round this just a hair. Go to your condenser now and just test it out. I can improve that one a little bit more. I'm perfect right in here. I need to open that. Make sure it's the right one. Yeah, I think the other one, actually, both of these ends are pretty close to each other. No, this is the one. All right. Yeah, I'll open that up a little bit. So I'm not quite satisfied yet. I'll get it. You might spend 45 minutes on your first one, maybe an hour. Second one you do, definitely less time. You should try to keep track of your time. You know, you want to be time efficient. And I teach this in the class on campus. Always stay time efficient. You know, you don't want to dilly-dally. You know, once you start it, finish it. Don't pick it up, bring it back. You know, if you have an emergency, go and do that. The buccal pit, let's show you where that's at. We call it the buccal pit, but it's really the mesial buccal pit, but it's got a general term. It's not in the middle third. It's more toward the occlusal third. It's where this groove ends. It's right about here. And then you can just draw it. It's even smaller than that, you know. This is the distal buccal pit. So it's this tooth that's in the arch. And this is the lower left. So it's in the arch. And so I've turned this around. So this is the buccal side, but I've turned it around. So you push it down inside. So it's toward the mesial, right? This is the distal. So let's just say you wanted to practice on the first one. So you did a mesial buccal pit, and then you went to the distal and you did a distal buccal pit. That's fine on your practice. When you go to present it, I'd like to see the buccal pit. All right. On the lingual, again, the CEJ will determine how far gingivally you go. Here, it's pretty easy. The CEJ is right below this gum tissue, so your prep should be just above that. We'll mark it. It's a trapezoid, and it's going to be not as, it's going to be wider than it is tall. So the width of it is going to be wider than it is tall. That's about it. It's very subtle, small, and it's a class 5. It's a cervical portion. I didn't wear a mask, and I'm ready to cough already. Isn't that something? Okay. I know I tossed her somewhere. Incidentally, you can buy a bunch of penny nails, Home Depot, when you're getting your alcohol. If you want to get a few more nails, you can get them in case you lose it. Okay, so that's this tooth. Good luck with it. Don't forget the more narrow, I want to say smaller base is toward the gingival. Look how close we are to the CEJ. CEJ is right here. So that's exactly where the crest of the tissue is. So we're right above it. Right above it. Focus that. Yeah. All right. Class 1, Class 5, number 19. Here's our premolar. Now, do this one second because it's harder. Class 5 on this. Here's your gingival. Third. Here it is on the model. Okay, so you're going to be right in here. Again, here's your contour, mesial and distal contour, so you're going to develop it. There's a little smiley right there. I mean, that's a perfect top. You can see where the tooth is actually, the mold is made. And then you drop it down. Again, you're going in this direction. Again, it is wider than it is tall, but it's a little more proportional than the molar. The molar actually is longer widthwise. This one is it's smaller. It's like half the dimension. So that's it. That one goes there. Let's show you some. Here's one. Let's see if I can focus here. Yep. So you can run your pencil on this one and pick up a lot of imperfections. That's another way to find out. And you can take alcohol to take your marks off if you wanted to do that as you presented in dental school. Or you can use even a red pencil, maybe non-lead pencil might help. Again, then you can blow it off and see where all the scratches are. Okay, so this student really, they got the job done, but they were a little carefree on the surface. So, that's what you want. You want margins that are distinct, not all over the place. And internally, I don't feel a real strong presence of internal line angles. It's very rounded, very rough. So this one needs work. How would I do it? I would take my 699. I don't want to open this up anymore. And I would just lay the tip in there. And I wouldn't, I would make sure that now I'm coming in 90 degrees to the tooth. And that's how we do the class 5s. You want to stay now almost perpendicular with the surface of the tooth. And to be even more correct, this floor should mimic the outer surface, which is rounded. I'm not sure if they're going to be that picky. They were in my dental school, but they might show, not only that you're going to be done with this soon, but we want to also see, a little more expertise when you're creating the floor. And practicals are almost 3 hours long, by the way. So they really give me a lot of time to get it right. All right, let's see another one. Okay, so this one has a little bit more of a roundedness to it, maybe more of a composite, but it's very, very smooth, and there's hardly any texture at the surface. If I run my pencil over this one, all I'm going to see are the margins. This is beautiful. That's a beautiful prep. So this student did really, really well. Let me get closer to this one. You can see, look at how much attention this person spent on getting these walls done right, aligned with the side of the tooth here. All right, so, and internally, if you take your super sharp edge, you can feel those internal line angles. I mean, I'm just skating in there. It's beautiful. All right, so that's the contrast between those two. Questions? Anything? I know this is all new, but I hope tonight that I was at least able to give you the fundamental, the essentials to tooth preparation. I know there's always something I forget, but if I did forget anything, you'll probably pick it up in the video. It almost makes sense now. You've probably taken some notes tonight, maybe review this video, and some of the other ones that I have in the library are more candid. They're at the class, a little nicer to, more fun to listen to, but we're pretty intense. We want to make sure that that you get it, and if there's extra time you need, please let me know. You should have enough time, 2 weeks to get through this part, and then you'll see once you get through this part, the next module is going to be pretty easy to understand, where we'll get into the class 2 and the class 3. Even on the central, you'll be able to do a class 5 as well. We have extra credit for class 3s, and then class 2. You only have one chance at the 2, so I'll be very, very good about showing you how to do this prep and how to drop that box properly and make it happen. So you'll have your class 5 sitting over here. We really want you to do a really good job with that tooth. So, and then of course number 20, which is an MOD. Now you've got a tooth now that you're going to be doing 2 sides of the tooth, and so now you really got to pay attention when you're dropping that box, because you got another one here and another one there. So now you got 3 boxes you're dropping, and your attention to detail, exactly when you're getting into the proximal areas, how to stay fit, how not to deviate and run off the road and create a scratch, which is easy to do. All right, slow speed. That's the main thing. Slow speed, develop it, try to copy this outline. Use your instruments, how important it is to check your progress, and ask questions if you have any. All right, I'm going to switch to the main screen. And click off the screen share. You guys can see me now. And you see what I was wearing, my loops and my eye protection. But anyway, what else can I tell you? Have a great evening. Enjoy the module. Feel free to contact me at any time, whether you want to send me a quick email or if you want to send me a text or any type of stuff through Canvas. Take a quick photograph. Practice taking your photographs. You know, it's important to get it right. And have fun. You know, that's the most important part. And we're serious, but we're going to have fun. And you know, you're going to make mistakes. You know, it's just part of the biz. We do it every day. Tonight, you know, I took an implant impression. I'm going to wax this up. So this is my case, and it's an implant case. And so I've already waxed up. The surgeon had this with my partial wax up that's in gray, and he had to remove these teeth. So now I took the same wax up, putting it in with the model, and I'm actually going to re-wax it and refine it a little bit more so that I get the camera right. It's here somewhere. There it is. So I can get the camera right. So I can go in here and make a more symmetrical wax up. So when we cover that in Toby's, we'll have some other cases to show you, you know, about give you a preferred future in waxing. You will be waxing in dental school, but to what level, we don't know. I don't know. Every school is going to be different. We're now in a digital age, so a lot of stuff you're going to learn now, maybe a little less. But scanning, you know, requires technology and skill in your preparations. So if you do all this right, scanning is going to be a piece of cake. You won't have any guesswork. Scanning also makes you a better dentist because you can blow things up on the screen with the intraoral scanners that we have for CAD/CAM. So we'll talk about CAD/CAM when we do the crowns and the veneers, and I'll show you some CAD/CAM work that we live with today. So, all right. What else can I say? But time to go watch the baseball game for me. And I don't know. I guess 2 of you were here tonight. Maybe more of you are here tonight. But I can't see everybody on the screen. But I want to wish you all well this week and enjoy. And we'll end the meeting. All right. Have a good evening.
Thank
You
you.
bet. My pleasure. Take care.
Bye.
Bye-bye.